Every night, without much thought, you close your eyes and let your body settle into the familiar position you've done hundreds of thousands of times before. It feels so normal. It feels as if you're simply turning off the machine. But as soon as your consciousness recedes, your body moves forward and begins a chain of biological processes that are highly dependent on your lying position. The brain activates a specialized fluid drainage network. The heart adjusts the amount of blood pumped based on the angle of your torso. The diaphragm adjusts the space with respect to all surrounding organs. The spine either adjusts itself smoothly or absorbs hours of mechanical stress, accumulating over the years and leading to actual structural damage. Sleeping position isn't a random choice based solely on comfort. It's a physiological response reflected in nerve signals, airway shape, hormone rhythms, and gravity, all of which your body adjusts to each night. Some positions protect the brain, others protect the airways. Some are harmful to the neck but protect the lungs. Understanding the true function of each element in the body is the first step in utilizing sleep as its inherent restorative system. Today, we will decode the messages the body sends through each sleeping position, using the language of physiology and the nervous system. Fetal position. Nearly half of adults tend to sleep in the fetal position, knees pulled towards the chest, chin slightly tucked in, and body curled up. This isn't just a choice for comfort, but a neurological reflex with clear evolutionary origins. This position brings the heart, lungs, and abdominal organs inward within the protective arch of the spine and ribs, while also tucking in the limbs to reduce heat loss, a survival advantage in the cold environments of our ancestors. However, excessive curling of the body affects respiratory mechanics. The diaphragm, which needs to lower to create negative pressure in the chest cavity, has its movement restricted. Chest volume decreases, the amount of air inhaled with each breath is lower, and this is associated with shallower sleep, easier awakenings, and morning fatigue. Prolonged shallow breathing can also slightly increase nighttime cortisol levels as the body recognizes the reduced oxygen as a form of physiological stress. The hip and knee joints are subjected to continuous bending and compression forces for many hours. In individuals with early-onset osteoarthritis or chronic synovitis, this nighttime pressure can contribute to faster cartilage wear compared to normal daytime activity. Despite these limitations, lying on your side offers clear benefits for the airway. It helps pull the base of the tongue and soft palate away from the back wall of the throat, reducing airway narrowing, limiting snoring, and alleviating the risk of sleep apnea, a condition associated with hypertension, stroke, and type 2 diabetes. Lying on your left side also reduces pressure on the inferior vena cava and is therefore often recommended during pregnancy. The solution isn't to abandon the position, but to refine it. Instead of curling up tightly, maintain a gentle spinal curve, extend your legs at a more open angle, and place a firm pillow between your knees. This helps stabilize the sacroiliac joint, reduces lumbar twisting, and keeps the hips out of maximum flexion, while still maintaining the airway protection benefits that are the greatest strength of the side-lying position. The position of the log, there is a small group of people who sleep on their side, but keep their bodies almost completely straight, without curling up. Their arms are placed along their sides, their legs are extended, and the axis from their shoulders to their feet forms a relatively straight line. It may look rigid at first glance, but for neuroscientists, this posture has clear biological significance. During deep sleep, the brain's lymphatic system, the brain's waste-clearing system, becomes highly active. Supporting cells contract slightly, expanding the interstitial space to allow cerebrospinal fluid, CSF, to flow, carrying metabolic byproducts out of brain tissue. Among these is beta-amyloid, a protein linked to early Alzheimer's disease. Research from the University of Rochester and neuroimaging studies in humans show that lying on your side supports this cleansing flow more effectively than lying on your back or stomach, due to the optimized intracranial fluid pressure differential. However, the benefits for the brain don't come without trade-offs. When lying on your side, the lower shoulder bears the lateral weight of the body for hours, reducing local microcirculation. Because nighttime tissue recovery depends on blood flow, prolonged compression can result in the shoulder receiving less oxygen and nutrients. The brachial plexus, which runs from the neck through the shoulder, can also be constantly irritated, causing prolonged numbness or discomfort. Mechanical pressure also affects facial skin. The repeated compression of collagen by the pillow over thousands of nights can create compression wrinkles. Unlike expression wrinkles, which are usually symmetrical, sleep wrinkles are often asymmetrical and deepen with age as the skin loses elasticity. Therefore, the supine position may be optimal for the brain's cleansing system, but it still carries mechanical consequences for the shoulders, nerves, and skin. This is a prime example of the general principle. Every sleeping position is a balance between biological benefits and costs. The position of the aspirant for those who prefer a side-lying position without complete stiffness. The sleeper will extend both arms forward at chest level. Legs can be straight or slightly bent, and the overall posture evokes forward movement, as if the sleeper is slowly reaching for something out of reach. This position is not simply a stylistic variation of the side-lying position. It has its own distinct biological structure with specific advantages and a particular neurological weakness. Extending the arms forward contributes to a slightly more open chest cavity compared to lying on your back. The anterior shoulder capsule, which tends to be stiff in people who spend all day working at a desk or using a keyboard, will be gently and passively stretched throughout the night. Sleep position researchers who study musculoskeletal rehabilitation note that this continuous gentle stretching during sleep, while not a substitute for active stretching, can significantly reduce anterior shoulder stiffness over time in people who regularly sleep on their backs. The benefits of lying on your side for the lymphatic system and airways are fully preserved, and the pressure distribution on the shoulder is slightly more favorable than lying flat because the extended arm helps to reduce some of the rotational weight acting on the joint. The risk of nerve damage lies in the brachial plexus. This nerve network runs from the cervical spine through the scalene muscles in the neck, beneath the clavicle, and into the arm. Extending the arm forward for extended periods stretches this nerve network, and many hours of such strain during sleep are known to cause symptoms of thoracic compartment syndrome, including numbness, tingling, and intense aching sensations concentrated in the forearm and outermost fingers. People who don't sleep well and frequently wake up with discomfort in their hands may be experiencing early signs of postural nerve compression, which, if left untreated for years, can progress from occasional morning symptoms to persistent daily discomfort. The side you lie on has significant clinical implications in ways most people are unaware of. The stomach is located on the left side of the center of the abdominal cavity, and the junction between the stomach and esophagus means that lying on your right side allows stomach contents, including acid, to move more easily toward the lower esophageal sphincter. Lying on your left side utilizes gravity to keep stomach contents concentrated in the body of the stomach, away from the junction with the esophagus. Gastrointestinal studies published in reputable scientific journals have consistently shown that sleeping on your left side significantly reduces the exposure time of esophageal acid in people with gastroesophageal reflux disease, GERD. For the approximately 20% of adults who regularly experience acid reflux symptoms, choosing this sleeping position may be more effective in reducing nighttime symptoms than many over-the-counter antacids. Soldier's stance. A person lying on their back with arms along their sides, legs extended, and face towards the ceiling is in a position that spinal anatomists would consider nearly ideal from a mechanical standpoint. The spine lies in its natural lordotic and kyphotic curves without being displaced laterally or subjected to rotational loads. The intervertebral discs, gel-filled structures that act as shock absorbers for the spine, experience the most evenly distributed pressure in this position. For the intervertebral discs, this is crucial because they receive nutrients not through a direct blood supply, but through a diffusion process driven by the alternation between mechanical load and load release. The supine position provides even and widespread pressure relief, supporting this nutrient exchange more consistently than any other position. Over a lifetime of sleep, this difference in disc nutrition accumulates into a measurable difference in disc health and spinal resilience. Nerve pressure points affecting side sleepers, particularly the brachial plexus and ulnar nerve, are virtually absent in soldiers. Weight is distributed symmetrically throughout the body. No nerve clusters are compressed against a hard surface, and the legs are extended straight, preventing the hip flexor shortening often experienced by side and stomach sleepers due to keeping their hips flexed throughout the night. From the perspective of facial skin aging, sleeping on your back is clearly better. No part of the face is in contact with the pillow, meaning the mechanical forces that cause wrinkles due to compression during sleep are completely absent from the skin. That's why dermatologists specializing in non-surgical skin preservation always recommend sleeping on your back as one of the easiest and most free methods for patients. The most serious problem with sleeping on your back is respiratory issues. The pull of gravity on the lower jaw and the back of the tongue when lying on your back narrows or obstructs the pharyngeal airway. The upper airway has a cross-sectional area of about 2 to 3 square centimeters when open, and sleeping on your back can reduce this area by 30 to 40% in susceptible individuals. The vibration of the surrounding soft tissues rubbing against this narrowed airway is what causes snoring. Complete, intermittent obstruction is called obstructive sleep apnea. In addition to the noticeable disruption to sleep structure, sleep apnea causes repeated mini-awake episodes, activating the sympathetic nervous system and leading to sudden nocturnal hypertension. Long-term studies have demonstrated that untreated sleep apnea is an independent risk factor for atrial fibrillation, coronary artery disease, insulin resistance, and rapid hippocampal volume depletion, the brain region most directly involved in memory formation. Starfish pose a small percentage of those sleeping, about 5%, stretch their arms straight up and out over their heads, while spreading their legs wide across a large portion of the mattress surface. This starfish sleeping position might seem similar to the soldier's pose at first glance, but its mechanical and thermal effects are significantly different, making it worthy of separate study. Raising both arms above heart level has an immediate impact on the functioning of the shoulder joint. The deltoid and rotator cuff muscles will fully relax when the arms are in a resting position above the head, releasing the compressive contact between the humerus and the shoulder socket that occurs when the arms are at the sides. For those with subacromial impingement syndrome or rotator cuff tendinitis, this overnight release of pressure on the joint can contribute to reduced morning pain. Researchers studying cardiovascular sleep have also observed that the arm-raised position encourages slightly deeper passive chest expansion during light non-REM sleep stages, because the anterior chest wall is no longer held down by the weight of the arms and associated muscles. The thermoregulatory benefits of the starfish pose are based on fundamental heat transfer physiology. Body temperature needs to drop by about 1 to 2 degrees Celsius for the sleep-inducing mechanism to be fully activated, and this cooling process is primarily achieved through vasodilation in the skin of the hands and feet. By spreading the limbs wide and exposing the wrists and palms inside, the starfish pose maximizes the surface area for heat to escape. Research on insomnia has found that people with impaired peripheral heat dissipation, meaning those whose hands and feet remain cold at night even when their torso is warm, take longer to fall asleep and experience more disrupted sleep. For these individuals, the supine position, starfish position, may offer passive temperature regulation that other positions cannot. Nerve weakness is concentrated in the elbow tunnel. The ulnar nerve, which controls sensation in the ring and little fingers, as well as motor function of many small muscles in the hand, passes through a narrow fibrous tunnel on the inner side of the elbow. Holding both arms bent high for extended periods stretches this nerve and compresses it within the tunnel. Chronic elbow tunnel syndrome due to sleeping position is a documented clinical condition that, if progressive, can cause persistent weakness in the arm, going far beyond the simple numbness most people who sleep in the starfish position experience upon waking. For anyone waking up repeatedly with numbness in those specific fingers, sleeping position is often the first factor a urologist will consider. Freefall position, sleeping on your stomach. The prone sleeping position occupies a unique place in sleep science because it is the only primary sleeping position whose benefits are primarily mechanical rather than neurological or cardiovascular. It works effectively in one particular area, but simultaneously causes measurable harm in many other areas. The cervical spine in prone sleep is subjected to a level of mechanical challenge unmatched by any other sleeping position. Breathing requires the neck to rotate 60 to 90 degrees and maintain that rotational position under the pressure of the skull throughout the night. The vertebral arteries, which supply blood to the cerebellum and brainstem, pass through the bony canals in the cervical vertebrae and are susceptible to restricted blood flow under the constant rotational pressure. Clinical neurologists have noted a link between prone sleeping habits and morning symptoms, including dizziness, visual disturbances, and occipital headaches, which disappear within an hour of waking, consistent with overnight compression of the vertebral artery. The cervical spinal discs also experience prolonged, asymmetrical loading in this position, contributing to accelerated degeneration on the rotationally loaded side compared to the opposite side. In the lumbar region, lying prone disrupts the natural arch of the spine and sometimes forces it into an arc against the mattress surface. The facet joints at the back of each lumbar vertebra, designed to guide movement rather than withstand constant compression, are directly loaded in this position in ways that contribute to facet joint degeneration over time. Lumbar disc pressure measurements in prone sleepers revealed a load distribution that was mechanically most unfavorable compared to any other sleeping position studied. For individuals with chronic nighttime back pain, prone sleeping was consistently associated with waking pain intensity exceeding bedtime pain levels. The only real advantage is airway protection. The prone position allows the tongue and soft palate to slide forward and away from the throat wall, eliminating the gravity-induced upper airway obstruction seen in supine sleepers. For those with severe postural obstructive sleep apnea who cannot tolerate continuous positive airway pressure, CPAP, or side lying, prone sleep may be the only practical option to keep the airway open. Removing the pillow from under the head significantly reduces the rotational angle of the cervical vertebrae and is the most effective measure for those who sleep in this position and experience neck problems. It's a small adjustment, but over years of accumulated sleeping, it represents a significant reduction in the mechanical load the cervical spine has to bear. Based on biological evidence, no single sleeping position is perfect for all systems simultaneously. Each position has trade-offs. Lying on your back is good for your spine, but can obstruct your airways. Lying on your side supports brain function and reduces reflux, but puts pressure on your shoulders. Lying on your stomach may reduce snoring, but can strain your neck. Therefore, the question isn't which position is absolutely best, but rather which position creates the lowest total biological cost to the body and prioritizes your health. The good news is that small mechanical adjustments can significantly shift the balance of benefits and risks. Placing a pillow under your knees when lying on your back helps reduce pressure on your lower back. Hugging a pillow when lying on your side helps stabilize the spine and prevent rolling over. Slightly raising the head of the bed by 10 to 15 centimeters can simultaneously reduce reflux and limit airway collapse. These aren't complex interventions, but rather simple adjustments that accumulate effectiveness over the years. Adults go through 4 to 6 sleep cycles each night, and their quality depends not only on the duration, but also on how the body is supported throughout that time. You spend about a third of your life lying down to sleep. Your posture during those hours is not passive. It's either supporting your physiology or subtly working against it. Tonight, the most important question is simple. What can you adjust to make your sleeping position more suitable for your current body?